All right. So what we are talking about is that HADS, hands-on diagnostics, is creating an expansive future that not only safeguards but advances the physical therapy profession. So let's think about this for a moment. The viability of any profession, including the physical therapy profession, is determined by its actual value, but also the perceived value of that profession by the society. Wouldn't you agree with that? So the more valuable a profession is, and also is being perceived by the society, the more viable that profession will be, because the society would want and need the services of that profession, and they will pay for the services of that profession. So let's look for a moment the current model of physical therapy. You do an initial evaluation, you create a treatment plan based on that initial evaluation, a treatment intervention. You do a reevaluation, you adjust your treatment plan, then you continue with PT, and at some point you end the care. So the results of your treatment are based on the ability of this model to provide the best outcomes for your patient, right? So remember for a moment, this viability is determined by the actual and perceived value. So to have actual and perceived value, you have to deliver results. Your results depend, your outcomes depend on the type of model, the type of methods, techniques, treatments, the whole idea, the whole concept that you will implement in your physical therapy continuum of care. All right. So, but let's look at this right now. When your treatment plans are based on just the physical examination, the physical therapy initial evaluation that you are performing, let's look for a moment, what are these outcomes? Where are they based on? Let's look, for example, that you are evaluating a patient for a potential carpal tunnel syndrome. What are the special tests that you do? How do you derive to the idea, to the diagnosis that the patient does have a carpal tunnel syndrome? You do a Fallen's test and a Tinel's test, right? But look at the degrees of sensitivity of the Tinel sign, only 23%, Fallen sign, 51%. For a patient with cervical radiculopathy, what is the number one test that you do? Sperling's test or Quadrant's test. They have 30% sensitivity. What does this mean? What does sensitivity mean? It means that if you have a room full of patients with carpal tunnel syndrome and you did a Tinel on them, despite the fact that all 100 patients have carpal tunnel syndrome, only 23% of them, only 23 of them will show positive on a Tinel sign. The rest, 77 of the patients are a false negative. They have the condition, they have carpal tunnel, but your test cannot show it. Look at cervical radiculopathy. 70% of the patients, if 100 patients in a room, they have cervical radiculopathy, only 30% of them will be able to be identified by a Sperling test. So if we base this data to this, if we base our treatments to these special tests, what type of outcomes are we going to have? Well, let's think of this for a moment, right? We are going through the whole coronavirus situation. Just imagine for a moment that the coronavirus test only identifies positive 30% of the patients who have coronavirus and 70% is false negatives. Would that be a good test? Would you accept that test that will give you the truth only 30% of the time, or 23% of the time, or even 50% of the time? I mean, you cannot base the results of your test and a treatment in a chance that is equal or worse than tossing a coin that has 50% chance to get heads or tails. 30% chance on a Sperling test, that is even lower than flipping a coin. There's something wrong with this idea there, you know? So let's see now, what can we do about this? Let's look at what is the diagnostics approach. In the diagnostics approach, we introduce a new paradigm for physical therapy. We are implementing for appropriate patients diagnostic testing at some point after that initial evaluation. This diagnostic testing can be electromyography, nerve conduction studies, somatosensory evoked potentials. It can be musculoskeletal ultrasound or neuro ultrasound, yes, measuring that nerve visually and measuring it rather than doing a 23% accurate Tinels. So new research evidence suggests that this new paradigm can offer better clinical outcomes and improved patient experience and increased patient participation in care, and also a significant increase in overall revenue for the practice. So let's see how this would work. When you incorporate these tests in the practice, you will enjoy a sensitivity far greater than the sensitivity of the special tests. Double and triple the sensitivity. So what happens when you are able to diagnose more accurately, to do a more accurate physical therapy diagnosis to your patients? Would you not apply then a more accurate treatment? Would you not then obtain better outcomes from your treatment? Well, let's look at that because there is a proof for that. We recently published a study at the Journal of Bodywork and Movement Therapies with a population of 462 patients. We identified that the physical therapy patient management in the group that received the diagnostic testing, the electromyography in this case, changed by 61% as a result of the tests we obtained from the EMG. On a similar study using ultrasound, patient management changed by about 62% because of the data that was obtained from the ultrasound. So you can see that the patient management changes by a significant amount when you implement these type of tests. And actually, this study was very much in alignment with another study that was published in Muscle and Nerve for primary care practices and the incorporation of electromyography in these practices. There was a change in management by 60% in those cases. So the numbers are very, very similar. So what type of tests we're talking about? We're talking about electromyography testing and nerve conduction that evaluates the integrity of the muscles and nerves from your fingertips all the way up to your neck. Evoked potentials that evaluates the integrity of the nervous system from the spinal cord all the way to your brain cortex, but also we're talking about musculoskeletal ultrasound to evaluate the joint integrity, and neuro ultrasound to evaluate the nerve integrity, and VNG testing for vestibular dysfunction. So let's take a look for a quick moment on what one of the HUD's partners who performs diagnostics in their practice had to say about the revenue growth that they have realized from diagnostics.
He entered into that. It became really apparent that there was no way we could step away from what it did financially for our practice. And you can see some numbers here for Superior PT. Our revenue per visit before HODS and PT only, or more revenue per visit with HODS jumped up to 137. And so, we see a 31.7% increase. And over 12 months, it's very, very dramatic in what that can do for a physical therapy practice.
So what you see are things that you can get in your own practice too.